Welcome back. Suicide is a topic some don't want to discuss, but national suicide rates are at their highest level in 20 years. Very alarming. Madison Scott is a clinical therapist with Behavioral Health Services of Arkansas. Thank you for joining us today.
Yeah, sure. I'm glad to be here.
Well, it's such an important topic, and a lot of parents just don't know how to address it with their teenagers. How do they do that?
Well, first of all, they need to know that it's very important that just because they want to talk about this subject doesn't mean they're implementing this idea into their head. The idea is already there, so please don't be scared to do that. Second of all, they just need to be mindful of the age that their child is and use vocabulary to fit their appropriate age.
Very important. You work with teenagers every day.
Yes.
You see the struggles that they're dealing with. It's a hard time to be a teenager.
It really is.
Kind of talk about that and the struggles.
Well, social media is huge. Bullying has always been a thing, but social media has just really impacted this tremendously. And you see signs of depression by them being really sad. Maybe they don't even care to play with their phone anymore. I mean, that's a huge sign. Teenagers want to play with their phones. So if they lose interest in activities, that is a big deal.
It's so sad to see. You know, we talk about that. Kids are bullied at school, but now that bullying comes home with them. There's no escape from it for kids, which is so tough. And hopefully this is reversed, and hopefully social media, something happens where our kids aren't dealing with this all the time. Kind of talk about what parents can talk about, any age, what they can talk about with their kids when they're talking about this.
You know, stress happens for all ages. So I would say start there. If they see signs of stress, if they see their child not acting different, don't be afraid to ask them what's going on. So yes, be a parent, but also step back and try to put themselves in their shoes for just a moment. I know even as adults, we all have that stress too, but they just don't have the skills to handle that stress and manage that stress quite like we do. So they just need to be understanding of that and just go into that, being aware of that and talking to them about how to manage that stress and what they can do. And I would say it's never too early to get them set up with a therapist. Talking helps, talking matters, talking saves lives.
Absolutely, so important. Now on the suicide discussion, at what age do you talk to your children about that?
Oh gosh, I think it just kind of depends on the situation and then the environment they're in. I mean, you know, if you have a family member that's died by suicide, you're obviously going to be questioning. Your 5-year-old's going to be like, well, where's Aunt so-and-so? Going to be questioning that. So they just need to, using age-appropriate language,
Very important.
and talk to them about it as early as they can.
What's your advice for parents out there that are just struggling to connect with their teenagers?
I would say just, again, just talking to them as soon as they can, making sure that they're available to them, getting them set up with someone, a therapist if they need to, and helping them realize that, you know, time is precious and being able to be that ear for them.
So important. Wonderful advice. Madison, thank you so much. I know
so
you help a lot of teenagers. I've done
Yes.
stories with you before, and you are making a big impact, so thank you for what you do. We'll be back after this. Stick around.